All right, it's time for our weekly conversation with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good morning, Dr. Bogoch. Thanks for joining us this morning. We're really going to talk a lot about COVID this morning. You know, given cases and hospitalizations are on the rise right now, are these new vaccines that are coming out potentially too late?
I think we're going to start to see the vaccines roll out pretty soon. And in fact, probably later this morning, we'll hear from the National Advisory Committee on Immunization as to who should be vaccinated, and we'll probably hear more granular plans for the vaccine strategy. But, you know, there's a couple of things to consider. Number one, we've got some new vaccines that are coming out, and we'll hear about who should get vaccinated and when. I think the other important thing to remember is there's no shortage of vaccines right now. And there are some people, I'm not saying everybody, but there's some people who might not be able to wait. Most people can probably wait for the newer vaccines to roll out. Some people might not be able to wait, and they can still get vaccinated if they need a booster between now and when the other vaccines will be rolling out shortly. So I think that's really important. And if anyone has any questions on whether or not they should wait or whether they should get a vaccine right now, talk to a healthcare provider, a physician, a public health specialist, a nurse, a pharmacist. There's plenty of healthcare providers that can discuss this with you.
Okay, and it's interesting, you know, we're talking about a range of different variants, you know, XB this, EG that, I can't even remember, I'm kind of losing track. But I'm wondering, you know, with all these sort of the vaccines that are coming out, how do they protect against these new and emerging variants as they continue to change? Or are the vaccines relatively, I realize they target specific variants, but are they relatively good at giving you a general amount of coverage as well, despite which variant people may potentially pick up?
Great point, and it's the latter. So certainly the vaccines have changed with time to better protect against this circulating variant du jour, but of course that changes, and we're always playing catch up, similar to influenza. But I think the key thing here is that regardless of the variant, the vaccines that have rolled out have consistently provided very good protection against severe manifestations of the virus, like hospitalization and death, regardless of the vaccines and regardless of the current variant. And I think that's the key point here. The heavy lifting of the vaccines that are going to be rolling out soon are really there to reduce the risk of severe manifestations of the virus. Yes, they'll probably provide some protection against COVID-19 infection for a small degree for a short period of time, just not to the same extent that they did earlier on in the pandemic. But it really will do some heavy lifting, keeping the highest risk people out of hospital.
Right. Okay. And of course, that is a crucial thing. So let's also talk about this. We've been reporting this all morning. The new numbers out suggest and show that only 5.7% of Canadians have had a shot or arguably a booster shot for COVID-19 in the last 6 months or so. So it seems for some people that COVID-19 has kind of become a little bit of maybe a little bit of white noise. What is your message to people right now when it comes to COVID and maybe how it's evolving at this stage?
Yeah, I think we've got to pick our battles. And I really think the most important thing is to focus the attention on those at greatest risk for severe manifestations of the virus. It's extremely important that those individuals get vaccinated when these vaccines roll out. And again, remember when the first vaccine rollout happened, we were bringing vaccines to the people, not bringing people to the vaccines. We were lowering every possible barrier. There were home delivery of vaccines. There were pop-up clinics. There were clinics in areas that were disproportionately impacted. Sometimes vaccines were even brought to places of work. And I think if we go through all those steps to really reduce the barriers to vaccination, especially for those who are at greatest risk, we'll be doing a lot of good, not just protecting the most vulnerable individuals, but also alleviating pressure from our healthcare system this fall and winter.
And that's my next final question, only about 30 seconds, but how is the healthcare system, the hospital system? We saw how it got rocked early on. How would you describe it right now?
I mean, it's always stretched. It's been stretched for ages. It's still stretched. Obviously, it's not nearly as bad as it was 2 and 3 years ago. But of course, you know, it's still pretty delicate. And every winter, even before COVID, we always talked about hallway medicine during flu season. You know, sadly, we're probably going to see something similar. So, you know, vaccination for flu, vaccination for COVID-19, this will help individuals, it helps communities, and of course, it does alleviate pressure from the healthcare system as well.
Dr. Bogoch, always appreciate the time and insight. Thanks so much for doing this morning. We'll see you next week.